The other thing is, have you been told how long it might take to get it better?
I'm told that you can expect up to a year before it's...
Yeah, so I think, again, that's useful for the chiropractors and physios and osteopaths, is that we are looking at a year here. Right. And a lot of people, I mean, I say to my patients, by about 8 weeks, you know, most people, most of your friends will think it's over. You know, oh, she's better, she's walking back, she's fine. Okay, but actually the patient will know that they continue improving up to a year up to surgery. And I think you're still a bit numb here, is that right?
Yes, that's just there it is.
So how soon do you get your patients walking after surgery?
So the day of surgery. So and did they do that to you? Oh, it's tough, isn't it?
I was going up the stairs in the evening, yes.
Yeah, so with modern analgesia now, we can make this, so knee surgery has a terrible reputation for being awfully painful. Was it awfully painful for you?
No.
Okay, so
no.
I mean, that's really good. Okay, so it's a great message again, because people are saying, oh, you shouldn't have a knee replacement. It's terribly painful, awfully painful. Yeah. And actually it's not if you're properly looked after, because they'll look after the analgesia, make sure you have a lot of pain relief. And of course that means we can get people moving now. So certainly with our partials, we can get them home the same day. And at home, you're much safer. But you know, it's great to see you getting up like that. Okay.
Again, I'm going to interrupt you because I know you want to go on, but Mike asked a question about how long it takes to recover from these. And you said it could be getting better over the whole course of a year. Are there various stages? We've got walking immediately.
Yeah, so we've got walking immediately, and I guess most hospitals will want you to walk. I want you to be able to do stairs, maybe one at a time, just as long as you're safe on stairs, and have what we call a stable wound, a wound that isn't bleeding or oozing, okay? And then those are the three criteria for getting thrown out. Right. And so that's the first stage. And then there's a stage that I think is about sort of 4 to 5 weeks, where you're not driving, but you're walking about more, you're getting used to the stairs. Sometimes people have some night pain. I don't know if you had any night pain after your operation.
Aching, I wouldn't call it.
Well, so you're tough, aren't you? You're tough. You can come and be my patient. So a lot of and again, your people might see that, is because they'll be doing the chiro or the osteopathy on them, and the patient will be saying, I don't know why this is, I have pain at night. What's gone wrong? And what it is that during the day, the movement of the knee will pump away the inflammatory fluid that builds up. And we can feel that Marion's knee's a little warm there. It's got a little fluid in it. So as she moves and keeps going, her pain during the day won't be that bad. And then they look forward to going to bed because they think, I'm resting my knee. That's the best I can be. And of course, it's agony. They have a lot of pain at night because they don't move as much. And so there isn't the pump to take the inflammatory fluid away, and the pressure in the knee builds up. And probably the best thing they can do is get out of bed, you know, walk to the loo or walk to the kitchen, make a cup of tea and come back again, because just that movement will decrease the pressure.
So do that before it hurts.
So yes, yeah. So that's quite important, that if people have an answer to that, it's greatly reassuring for the patient. It very rarely lasts more than 6 weeks.
Yes.
Which is why I see my patients at about 8 weeks, because at 6 weeks they'll kill me because they haven't slept.